Hello and welcome to another edition of the Lympha Press Educational Webinar Series. We just love bringing you great content every month with some of the most thought-provoking leaders in the fields of lymphedema, lipedema, CVI, and wounds. And I'm honored to introduce to you a familiar face and a brand new face to our platform tonight. By the way, I'm Brenda Viola. I'm honored to represent Lympha Press for tonight's webinar, Lifestyle and Lymphedema, Impacts of Nutrition, Exercise, Sleep, and Stress. Our presenters are Leslyn Keith. You know her well, of her affiliation with Lipedema Simplified, but also the many books she has written on lymphedema. And then welcoming Robert Erkstam, who is also a CLT-LANA occupational and lymphedema therapist based in North Carolina. They're going to introduce themselves, but let me first say welcome to all of you who are logging on right now. Let us know that you're here in chat. We enjoy that kind of feedback. Let us know where you're logging in from. Kathleen from San Diego, my friend Kathleen Listen, also an avid and wonderful, prolific writer. We're glad to welcome all of you. Please do put your questions in the Q&A. We will address them at the end of our webinar. For those of you on the West Coast, it's still the afternoon. For those of you on the East Coast, it's early evening. And as a preamble, let me just say that despite adherence with conservative treatment measures in standard lymphedema treatment, many people continue to struggle with their condition, suffering with greater swelling, pain, disfigurement, and repeated life-threatening infections. Well, today, we're going to be talking about this and how essential lifestyle elements for optimal treatment results can include ketogenic nutrition, exercise, sleep, stress resilience. These are topics that are important not just to the clinicians who are logging in, but also to the patients that we so want to help. And I will say this, my dear friend Alexa Ercolano, who is the marketing representative for Lympha Press, schooled me on a language change. I had written a brochure once, and I said, struggling with lymphedema. And she said, let's change that to living with lymphedema. We want to empower patients and clinicians to help people live their best lives. That's what we're all rooting for. That's why we do what we do at Lympha Press. So without further ado, I am so happy to turn the reins over to our tag team, our dynamic duo. I'm going to disappear and I'll be back at the end to handle the Q&A. Take it away.
Thank you, Brenda. Thanks for having us here. We're going to pull up our PowerPoint, our presentation for you and talk to you, as Brenda said, about lifestyle lymphedema and all those impacts of what we feel like are the four strongest impacts of nutrition, exercise, sleep, and stress. So I'm Leslyn Keith, and I've been treating lymphatic and fat disorders for over 20 years as a certified lymphedema therapist. I'm also an instructor for close training, and I've written, Brenda was so kind to say my many books, but I've written 2 books about using a ketogenic lifestyle for lymphatic disorders, and I'm also the president and director of research for the Lymphedema Project.
My name is Robert Erkstam. I'm also an occupational therapist, certified lymphedema therapist. I've been an occupational therapist for 24 years, and I've been in lymphedema therapy for 18 years, and I have a clinic here in Wilmington, North Carolina, where we've been treating lymphedema for many years, and I've also become a health and wellness coach. And then for the last 2-3 years, I've been working together with Leslyn also on our this online lifestyle program that we put together. So first, a disclaimer, and this is very important. We're going to talk about lifestyle today, and we're going to talk some specifics. So you may pick up on something that you want to change in your lifestyle. We really do strongly recommend that if you make any changes in your lifestyle, especially when it comes to nutrition, that you do involve your providers, your doctor, your lymphedema therapist. If you are currently taking medications, sometimes when we make these lifestyle changes, it can really improve things, which means the medications may need to change most of the time for the better. So we do want to strongly recommend that you keep your doctor and your therapist in the loop when you make these changes. And one quick disclosure. So Leslyn and I, like I mentioned, we have worked on this online program called Lymphatic Lifestyle Solutions Online, and you can find it at that shortened website right there, or if you search for Lymphatic Lifestyle Solutions Online. But we do have that program available to the general public. Okay, so let's jump into it. So let's do a little thought experiment first. There's a lot of words, a lot of text in this slide, but that's on purpose. So what if there was a treatment method that could do all of these things that are on this slide? I'm not going to read all of them to you. You can glance it over, but just starting up on the top, if we think if there was a treatment method that could reduce pain, reduce edema, reduce tissue fibrosis, reduce inflammation, improve mood and decrease depression, lower risk of heart disease, and so on and so on. You can see where this certainly would have a lot to do with lymphedema, but our health in general. It seems like if we knew of a treatment that had plenty of scientific backing to say that it can do all these things, we would be pretty interested in what that treatment is. We'd like to find out what it is. If we're suffering with, or like we said, living with lymphedema, we would want to know what is that treatment that can do all those things. And if we're a therapist, we certainly would want to know about this treatment so that we could recommend it to our clients. Well, it may sound hyperbole, but the things that we are going to talk about today have plenty of backing to do all of those things that were in that slide. So we're actually suggesting a different paradigm in thinking when we're working with lymphedema, and we call it a more complete paradigm for lymphedema therapy. So most of us therapists were familiar with how we've been trained that there's two phases to lymphedema therapy. We have the phase one. That's the treatment phase where we're reducing symptoms with all the modalities that we're familiar with. And that's, of course, an extremely important phase of the treatment. We have to reduce the symptoms, get the swelling down. So that's treatment phase. And then we go into what we call the phase two, the maintenance phase, the self-care. That's where we learn to wear compression garments, maybe using a compression pump at home, and all those things. Those are also extremely important. We are still mechanically managing a symptom when we're doing those things. So what we're proposing is that an essential part of a good lymphedema program, there should be a healthy lifestyle practice that overshadows the entire thing. Sometimes we even call this phase three in lymphedema, but we changed that because it felt like it doesn't really come after phase two. It really comes from the very beginning. And we're going to make that case today with our presentation. So what are those healthy lifestyle practices that we're going to talk about? We talk about 4 pillars of health, and they're we created this model in this way because they are so closely intertwined. And I think you're going to see that in today's presentation also, is that we're using the word reciprocal a lot because these things interact so much with each other. And I think most of us kind of intuitively know this. So we got nutrition, we got stress, we got physical activity, and we got sleep. Those are the 4 pillars of good health as far as our lifestyle and our habits. But if we eat good, then we tend to sleep better. And if we eat good, we feel better, which means that we are more likely to be physically active. If we're physically active, we tend to sleep better. That's proven. And physical activity is one of the best stress management methods there is. And if we're less stressed, we're probably more likely to eat better. So you can kind of see how all of this ties together. So we call that the upward spiral or the downward spiral. So it works in both directions. So like I explained there, how sleeping, has an effect on how active we are, and how active we are has an effect on sleeping, and vice versa. That works both in a positive way and in a negative way. So we want to focus on the positive. So the negative downward spiral explains why we can end up in this rut and feeling like we're so drained. But it's good to know that if we start somewhere, we start with one of those bubbles, and we suggest start with the nutrition bubble, because once we start feeling better, then we can address the other three. But then we build on top. It's a compounding effect. So you start somewhere, start with a little bit where you can. And when you start feeling better, then you build on top of that, so that we don't think that it's impossible. We do, to do a presentation about lifestyle and lymphedema, it wouldn't be a true and honest presentation if we didn't bring up the uncomfortable elephant in the room, which is obesity. And it's a touchy subject to bring up because there's so much judgment and stereotype associated with that. But we have to bring it up, and our experience in the clinic has been that it isn't that uncomfortable to bring it up. Most people are very aware of the problem and have tried very, very hard to change it, but they just perhaps don't know really how, because it isn't easy. And most are very relieved when we bring it up. So to the therapist, I would want to say, don't be afraid to bring that up. Most people are craving to be able to talk about that, about obesity. But when we look at how obesity is so closely tied to lymphedema, we can't ignore that. So if obesity is part of the picture with lymphedema, in a way we can say good, because that's one thing that it's what we can call a treatable risk factor. So when there are risk factors that aren't treatable, like age, we can't change our age. But if we have obesity as a risk factor, that's treatable. So that's a good thing. It's something that we can do something about. Not saying it's easy. So just briefly about the strong connection between obesity and lymphedema on this slide. We're showing how obesity on the left side contributes to chronic inflammation and vessel hyperpermeability. So that then results in chronic venous insufficiency, organ failure, metabolic syndrome, that's diabetes and those things. That increases the fluid load. That means we have more fluid for the lymphatic system to transport. And that then contributes to lymphedema. On the other side, we also have mechanical obstruction. So if we think of the lymphatic system, it gets more fluid to move, and it gets worse at moving. It doesn't move that fluid as well anymore because of all the mechanical obstructions that happen. And obesity also results in inactivity often, and then you end up with less movement of lymphatic fluid for that reason. So it really is a double whammy the connection between the two. So I'm going to hand it over to Leslyn, and she's going to talk about the first bubble of the four, which is nutrition.
And as Robert was saying, this is probably the foundation, the most important lifestyle factor to work on first, because it's going to make the other things that you do work even better and make them maybe easier to do. So we need a diet that's going to be optimal for lymphatic disorders. It should be good for health in general, but we really want to support lymphatic functioning if we're trying to manage a lymphatic disorder. It would be nice if it could also regulate weight. Not everybody needs to lose weight, so we want to more regulate weight than actually lose weight. But if you do need to lose weight, it's going to also be good for that. And then that will help us manage that excess fluid. We want it, as I said, to support general health and any of those other comorbidities you may have besides lymphedema. And then it needs to be an eating plan that's also going to address those food allergies, your various individual tolerances for certain foods, and your preferences for those foods. And lastly, it needs to be sustainable, because if it's not something you can enjoy for the rest of your life, it's not going to be useful in managing your lymphedema. So we suggest that that's ketogenic nutrition. And this is kind of a broad tent of what's considered ketogenic nutrition, but basically it needs to be real food. It's not that boxed, prepared food item that is labeled ketogenic, a ketogenic bar or something like that. This is, as you can see in this photo that I co-opted from the Diet Doctor website, this is all just normal foods that you would see into going to the produce section or the meat and fish section of your grocery store. So it's going to be real foods. And the salient point in ketogenic diets is carbohydrate restriction. The carbohydrates have to be kept really low in order to be ketogenic. And then we're going to supplement with healthy fats. And which fats those are really would depend on your needs and your preferences, and to not skimp on protein, because a lot of people are eating too low of protein. And we know from our study of lymphatic disorders that low protein in itself can cause swelling. So we want to make sure that we have adequate protein. There's a lot of research now that is backing this way of eating, and some of it goes back really far into the 80s. But we know that diets high in carbohydrate can cause inflammation in the lymphatics. In this one animal study in 2012, it showed that the lymphatic vessels on a high carb diet were so inflamed and swollen that they actually reduced lymph flow by 50%. So by eliminating carbohydrates, we are going to, even if the lymphatics are impaired, we're still going to have better lymph flow by reducing the carbohydrates. And fat actually encourages lymph flow because it causes increased contraction of those lymphatic vessels. And another two great studies that showed that ketones, which is a metabolite of dietary fatty acids, ketones stimulate the formations of new lymphatic vessels. And so when you have, for instance, impairment or destruction of lymphatic vessels because of, for instance, cancer treatment, when you have ketones present, we can actually stimulate the formation of new vessels that can go around that obstruction. And so we are seeing in various studies that ketogenic diets can reduce swelling, reduce fibrosis, reduce pain associated with lymphedema. So that really makes it an optimal way of eating. So I put here just a sample ketogenic food list of different produce, dairy products, meat and other proteins, and fats, oils, nuts, and seeds, and beverages that you would eat on a ketogenic diet. But now it needs to be individualized. And this speaks a little bit to a question I already saw posted by Valerie. You know, how do I figure out how I'm going to eat because I also have diabetes? And it seemed like when I tried a ketogenic eating plan that it made it worse. And so when we're trying to figure out what is going to be best for you by what your preferences are, if you want to stay more towards plant-based, or if you want to have animal source nutrition, what is your cultural and social needs? What is just your taste? What tolerances do you have, or intolerances? What allergies do you have? Are you using this for weight loss? So when all those things come into account, then we need to individualize it so it works the best for you. And I'm going to really suggest working with a health coach that has expertise in ketogenic nutrition to help you individualize this framework of a dietary plan, but makes it work best for you. This is, I'm really excited to share with you the Keto Lymph study, which has been going on since 2019 in Belgium. And most of the studies with ketogenic nutrition and lymphedema has been done with animals, because we can make an animal model of lymphedema. And so it's very easy to a diet study can be much more controlled when we do it on animals. So this is actually one of the first ones, besides my little tiny pilot study I did in 2017. This one is 100 participants with people who have lymphedema in a limb, either an arm or a leg, and they're being placed on 24 weeks of strict keto, followed by another 24 weeks of modified Atkins diet. And they're doing lymphangioscintigraphy and a bunch of things. And it might be doing ICG, I can't remember, but they're doing imaging along with taking all this data on the participants and seeing what the outcomes are. Dr. Sarah Thomas, who's one of the PIs, did a presentation on this last year to give the preliminary data, and it is exceedingly promising and very hopeful that it's really came out well for those that were able to adhere to the diet. It was estimated to be completed in January, and so I'm hoping that we're going to see a paper coming about this study soon.
Okay, so that is the first bubble, which is nutrition. And I have to say, me personally, I was just so thrilled when I saw those studies where lymph vessels can actually form on the ketogenic diet. That leaves such great hope that we can actually not just manage symptoms, but potentially actually improve the lymphatic system itself. Great news to be able to share with our clients. So the second part that we're going to talk about is exercise. And here's that slide again, because all of the things that were on that initial slide that we said that lifestyle can improve also pertain to exercise. And we didn't want to clutter the page up with the references on each of these claims. There is a list of references in the end, but every claim on this slide can be backed up with plenty of references. But if we look specifically at the first part of this, so what are some of the proven benefits of exercise? And I want to say that we're not only talking about what we call the decongestive exercises that are used in phase 1 and phase 2 lymphedema therapy. Those are very important, but we're talking about exercise as a whole, and we'll get into that a little more. But exercise is proven to reduce pain, reduce edema, reduce tissue fibrosis, reduce inflammation, strengthen the immune system, lower the risk for diabetes, help with weight control, decrease risk for falls, and on and on and on. It goes on here, but we can see that obviously all of these things are very good if we're dealing with lymphedema. So it makes sense to pay some attention to this. But it isn't always so easy to do exercise, and what we find with our clients is often they might have this belief or this idea that I can't exercise, and I've worked like with former military men and women, and their view of exercise, of course, is very, very intense, and it can be hard to like readjust and to think that what I didn't used to consider exercise is exercise now. We have to start where we're at. So what are some of the barriers that someone with lymphedema have to face when it comes to even just the thought of exercising? Well, first of all, you might be dealing with heavy limbs, and which impairs your mobility. So you might feel like, well, how am I going to exercise when it's so hard to move to begin with? There can be fears. There's still old advice lingering out there that exercise can make lymphedema worse. That has been debunked. It's been proven, including when it comes to post mastectomy or after breast cancer. With lymphedema, it's shown that those that exercise in most cases are less likely to get lymphedema. So we want to debunk those fears that exercise would make it worse. Of course, the link with obesity can make it more difficult to exercise. There can be a worry about appearance. So exercising in public places, they may feel embarrassed, pain, and infections. Now, all of these claims are both from our experience, but there's a study there by Buchanan from 2015 where they looked at the barriers for exercise with patients with lymphedema, and these are the things that came up as the barriers as to why it was difficult to exercise. But because it's difficult doesn't mean it's not possible. So we want to begin where we are. So where do we start? We want to think about I've worked with some clients where I'll say, well, if it's difficult to walk to the mailbox, then walk to the mailbox, and now you're exercising. And as that becomes easier, you walk to the neighbor's mailbox. We may have to rethink what we even mean by exercise, but we start where we are, and there's always somewhere that you can improve a little bit from there. Exercising water is excellent. We're going to talk a little bit more about that, but walking is not to be underestimated. Walking involves muscles, calf pumping. It's a good cardio, and we do actually, when we walk, tend to burn fat for fuel. So anything that increases the heart rate, consider that exercise. It is good to include something that has to do with resistance, and we'll talk a little bit more about that, to increase muscle, especially as we age. It's good to do something that involves some stretching or mobility. But one thing that we really want to emphasize here is that a little bit every day can make a huge difference. When they do studies on health benefits of exercise, and they look at people that exercise 10 minutes per day compared to people that exercise 0 minutes per day, there's a huge difference in health benefits. The list is really, really long. So the benefits begin already at 10 minutes a day. And then the benefits increases as we exercise more. And if we can get to 30, 40 minutes a day, that's great. That's even better. But don't belittle the value of 10 minutes of exercise. So that's what we really want to emphasize, so that we can start that upward spiral. And just like a plane taking off, it takes a lot of energy in the beginning to get that plane moving, but it will get easier. So water, exercise, we want to say is a word on that. That's particularly good when we deal with lymphedema, and there are a few reasons for that. If you have access to work in a pool, that's one really good form of exercise. Plenty of studies, and you got some references on this slide. One reason is you have the hydrostatic pressure. So much like a compression pump, when you're in a pool of water, if you're about chest deep, you might have as much as 80 millimeter mercury pressure at your feet, but it doesn't hurt. You also have the buoyancy, so that means you can do more because you're kind of half floating in that water, so you don't have as much gravity to deal with. There's not the fear of falling. So in one way, it's easier to work out in the pool, but on the other hand, you also get resistance, because if you're moving your arm through air, there's not much resistance. But if you move it through water, you have resistance. So you actually add some resistance, which makes that exercise really good. And then you have the immersion diuretics, which actually helps to drive fluids, a little bit like diuretics. So there are studies that have shown that the benefits to lymphedema from water-based exercise can be reduced swelling, pain, fatigue, improved cardiovascular function, improved strength, and range of motion. And then one word about resistance. So we know, if you're probably familiar by now with how important the muscle pumping is for the lymphatic system. So we know the lymphatic system needs mechanical motion around it in order for the fluid to pump efficiently through the vessels. So having good muscle activity is extremely important for the lymphatic system. So also maintaining and building muscle is good. And we tend to lose muscle as we age. So using weights and resistant bands, or like medicine balls or kettlebells or bands or cables, weight training is actually especially important as we age. So if we can find a way to incorporate some form of resistance training along with our cardio workout and some mobility, then we have a good program. And there, I'm going to hand it back over to Leslyn, where we're going to talk about the third bubble, sleep.
Yes. And so this is going to be, again, one of those reciprocal relationships. There's ways sleep impacts lymphedema, and how lymphedema can impact your sleep. So I think that most of you probably already know that there are benefits to getting good quality sleep. And so it can increase your concentration, your ability to attend to tasks, to make good decisions, It'll increase your creativity. You'll be better in social situations, and just your overall health improves if you get good quality sleep. But if you don't get good quality sleep, it can have a problem with your mood. It can increase your stress, increase your anger and impulsivity. And sometimes we do things to self-medicate, like drinking or smoking, when we're not getting good quality sleep. So some of the dangers, I think that most people are aware of this too. When you're not getting good sleep, you're a high risk for car accidents. Your cognition, your mental ability is not as good. And it really increases your risk for serious health conditions like heart attack and stroke. It decreases your sex drive. It increases your chance of being depressed or anxious. It can age you prematurely, and it can cause weight gain. There's a lot of studies associated with poor sleep and obesity, again, a reciprocal relationship. And unfortunately, there's a risk of death from all causes when you're not getting good sleep. So this is very, very important. One thing that we do know from the recent discovery of lymphatics that are in the brain and the spinal cord, so in the central nervous system, that the time that the lymphatics do their job in the brain is during sleep, because the brain cells shrink slightly, that it causes there be more room to work for the lymphatics. And so they're going to be much more efficient in removing that waste material, the toxins that can collect during the day. They're going to be able to clean that out at night. And so when we don't get good sleep, we don't give our lymphatics enough time to work. And so that gives you an increased risk of Alzheimer's, Parkinson's, and other neurodegenerative diseases. So it's really interesting how lymphedema and sleep affect each other. Of course, I've already said that your lymphatics are more active during sleep, but in one study, it said that 19% of the participants said that the discomfort that they experienced with lymphedema was disrupting their sleep. And so now the lymphedema could be increasing your chance of not getting good sleep, which could lead to these other things. In another study, they were comparing cancer survivors with lymphedema and cancer survivors who did not have lymphedema. And those that had lymphedema had a much higher incidence of sleep disorders. And interestingly, this other study here by Rue and others in 2020, this one was actually, it's a little bit biased with their patient selection, participant selection, because it was all inpatient. So these are all sicker people. But when they looked at those inpatient participants with lymphedema, the ones who had leg lymphedema had 85% of them also had sleep apnea. And the ones that had arm lymphedema, 56% of them had sleep apnea. So that was a pretty high incidence of a sleep disorder in that inpatient lymphedema crowd. And then lastly, in the earlier study that I talked about, night compression, which is very much needed for many people who have lymphedema, wearing their night compression itself can disrupt the sleep. So what can we do? How can we improve sleep? Given that we have lymphedema, we need to keep it managed overnight. How are we still going to get good quality sleep? Well, one thing is just to be aware of sleep disorders and get educated on that to see if that is something that is affecting you, and then go from there. One thing that you can do is excellent for lymphatics anyhow, but it also can help you get to sleep, is doing breathing exercises. So that may be something that you can add to your routine. And then what can you do just to improve your chances of getting a good night's sleep? And I list a few things here, but I think a lot of us are aware of some strategies that you can do to improve your environment just to help you get good sleep. So something that can block out that blue light. So from all of our electronic devices, not having those electronic devices in our bedroom, or wearing blue light blockers after, in the evening time. No caffeine, and later in the day, keeping your room absolutely dark, not letting any light in there at all. All these things and others can be good strategies just to help you get better sleep. And then if you are concerned that you might have sleep apnea or another sleep disorder, consider getting a sleep study and finding out what's going on, and so that you can take action.
Okay. So that brings us to the fourth bubble, which is stress resilience, and it's probably very easy to see how closely that ties into sleep, but also the other components. But first, let's start off with a couple of or a quote here. If one regards any stress factor as an infection, the obvious course of action is to increase the body's defense in staving it off. So that's a quote by D.O. Raymond Perrin. So our question that we want to ask is, what can we do then to fortify our lymphatic system against any stressor? So first, we have to look at why it even matters. Why should we even be concerned about stress? But more importantly, we want to look at what we can actually do to fortify it. There's one. Well, I'll get back to that. There's a little ironic study on that as far as awareness of the dangers of stress. But first, we have to mention that little elephant in the room again, obesity. So now we know that there's a strong link between obesity and lymphedema, and then we also know that there's a reciprocal relationship between stress and obesity. So that's one of the links between stress and lymphedema, we can say. So how is stress and obesity linked? Well, stress results in decreased executive function. That's those little short-term decisions that we make when we're exhausted, when we're tired. We tend to make worse decisions as far as what we eat and whether or not we exercise and all those things. But stress also results in hormonal dysregulation, increased appetite and craving. There's all kinds of reasons why stress contributes to obesity, and then the obesity in itself results in declining health. We know all the risk factors that results in, like increased risk of diabetes, heart disease, physical stress, pain, isolation, all these things, impaired body image. That in turn causes more stress. So that's another one of those downward spirals. But every time we think of a downward spiral, we want to think that the reverse is also true. If there's a downward spiral and you reverse it, that's an upward spiral. So just like with sleep, where Leslyn talked about how lack of sleep can contribute to lymphedema and how lymphedema can contribute to lack of sleep, the same is true with stress. So what are some of the things that relates to lymphedema that causes stress? Well, this is from a study in 2012, Reidner, and this is what they came up with, that lymphedema causes perception of being disregarded by healthcare providers. That's one of the stressors that people with lymphedema deal with. Some deal with poor body image, loss of functionality, permanent uncertainty. So there's this uncertainty about what's going to happen to me with this condition, and that's a sort of a chronic lingering stressor that many deal with. Some related that it could have or maybe they were afraid of. Stress is often things that we are afraid of, whether they have actually happened or not, but adverse effects on relationships and frustration and resentment with overwhelming self-care, meaning there's many things that you have to do to take care of your lymphedema. Before we look at what we can do, we do want to also look at what are the how does the body respond physiologically to stress? And it's important to know that it's not acute stressors that are dangerous. It's the chronic, lingering, ongoing stressors. And these are, I'm not going to go through all of these, but look at the first ones. So we know for sure that the body responds to stressors. I think we've made ourselves a real disservice over the years to try to somehow separate the body from the mind as if the body doesn't react to what the mind is doing. That's a pretty foolish attempt. We all know that we get sweaty palms and butterflies in our stomach when we're nervous. So there's a strong correlation there. So the body responds with a fight or flight response. And here are some of the things that it does. Sodium in water retention actually increases under chronic stress. We get more inflammation. There's a reason for that makes sense for acute stress, but it doesn't do us any good in chronic stress. Wounds don't heal as good when we're chronically stressed. Skin doesn't form as well. We get increased blood pressure, and it goes on and on. You can see the list here. So there are a lot of physiological responses to stress. So now we can see how this reciprocal relationship between stress and lymphedema is also true. So if we start up on the right, so we have lymphedema for some other reason, not because of stress. As you know, many reasons one can get lymphedema, but the lymphedema results in edema, inflammation, fibrosis, infection, and skin changes. Like we said on the previous slide, that then results in emotional stressors. And examples of those are disfigurement, poor body image, uncertainty about condition, loss of control over health, healthcare provider lack of understanding, time consuming care. Those are emotional stressors that are caused by lymphedema. There are also physical stressors, if you follow me around the circle. So loss of function, pain, those kind of things. Now, those stressors then the body responds to those with a fight, flight, or freeze response. So there are hormonal changes, cortisol, adrenaline, norepinephrine, all those. And the body begins to respond physiologically to the stressors with those things that I mentioned: inflammation, fluid retention, increased risk for obesity, sleep deprivation, excess. So that then results in exacerbation of lymphedema symptoms. And then, so then we have a behavioral stress response on top of that. So when we are stressed, it's harder to take care of ourselves. It's more difficult because we're just exhausted from the chronic stress. And then we start to disengage from things in life. And in the worst case, we start to get a feeling of giving up. I really hope nobody leaves this webinar right now, because I've only told you a pretty bleak picture of this. And I told you I was going to tell you about an ironic study. It's actually been shown that people that are aware of the dangers of stress actually have more symptoms of stress than people that are not aware of it. So just being aware of that stress is dangerous doesn't help us a bit. What we really want to focus on, if we want to learn about stress, are the things that are on this slide and many more things. In other words, the things we can do to become more stress resilient. And there's been so much good research done. There's not enough time today to really delve into the depth of these. I would even recommend, if you have your camera handy, just snap a picture of the slide and do some research on your own. I put breathing techniques on the top because breathing is especially good for stress management. Volumes of research to back that up. There are simple breathing methods that you can learn that will lower your parasympathetic nervous system activity. And that's been proven, and that's a measurable thing. We can measure heart rate variability. We can do some breathing exercises. I do that with my clients. And then we can, on the screen, see that the heart rate variability went up, which means they're in a more relaxed state. That means all these physiological stress responses that we talked about are going to decrease. So I really want to emphasize that point. There are things we can do about the way that our body responds to stress. We can become more resilient to the stress. That's why I started off with a picture of a guy swimming in ice water. That's actually one of the methods that we can use to increase our stress resilience. That's an extreme acute stress, but then we recover from that and we become more resilient. So it's not only about avoiding stress; it's about learning methods and training our body to be resilient to it. I have to be careful there because this is where time can run away, because I get passionate about this. But mindfulness meditation has also volumes of research to back it up. People that journal are happier than people that don't. So research all these things and don't feel like stress has to control your life.
So we wanted to share with you some results of people who have implemented these lifestyle changes and what's the impact that it had on their lymphedema or lipedema. So in my little pilot study that I did with 10 of my patients who were obese as well as have lymphedema, when they implemented the lifestyle changes, one of which was a ketogenic eating plan, you can see the people who did that in blue, they had much more weight loss in that chart on the upper left versus the people who did not implement the changes, they had very little weight change. And on the chart in the lower right, the limb volume change, which is very important to someone who has lymphedema. You can see in blue, those who made the changes, including a ketogenic diet, they had much more limb volume change. In the non-ketogenic group, we see that one outlier still lost a lot on his leg swelling, but the other people had very little change in their lymphedema.
So this is from the participants in Leslyn's own study at her own clinic, and so she did many of you therapists might be familiar with the LLIS. So she did the life impact scale with them, and you can see a significant difference, and of course a lower number is better here. So the participants felt that the impact that lymphedema had on their life, it had less impact on their life after they had completed the program. I guess we can say is the conclusion of Leslyn's study. So this slide shows, this was actually from participants at our clinic in Wilmington that went through this same program, the Lymphatic Lifestyle Solutions program. And what we wanted to see here, so we're looking at weight loss because pretty much all the participants needed to lose weight and wanted to lose weight as part of what they were doing. And what we wanted to know was what happened after the program. So they went through the program in 12 weeks and they all lost weight at an average of about 17.5 pounds. But we wanted to see what happens after that. Do they just gain the weight right back when the program's over? And we were so happy to see that they continued to lose weight at pretty much the same rate for the next 4 months before it started to plateau. And so that was pretty much on their own. I saw them once a month just to check in.
Because we have a Facebook group with over 14,000 members for keto lifestyle for lipedema. And this is just one picture of a woman who used lifestyle change, including a ketogenic diet, and she lost a substantial amount of weight over not very long period of time. And you could see how that had a big impact on her. And then also a patient in my clinic with lipedema and lymphedema. And she also lost a lot of weight, had her pain resolve and increased energy, all kinds of stuff. So, so we're seeing it in our clinics, and we're seeing it on social media. A couple of studies I wanted to show you. There's been actually quite a few using ketogenic diet with lipedema over the last 5 years. This is a case study of a woman with lipedema after 22 months using a ketogenic diet and other lifestyle measures. And she lost, again, quite a bit of weight, but also her percent body fat went down. Her blood panel was excellent. Her energy levels were good and decreased pain. Another study by actually a couple of surgeons in Brazil, and they said, we can do this non-surgically and using an intervention plan of a low carbohydrate ketogenic diet, manual lymph drainage, supplements, and aquatic exercise, that we can do all that. You can see to 11 months. And then she chose to have her liposuction. So it was a much easier surgery, a much easier recovery. She had much better outcomes because she did all the lifestyle stuff first. This is from Robert's clinic with his patients using the lifestyle plan. And so this is the SF36, 36 questions about how you're doing before you make the lifestyle change in blue and how you're doing after the 12-week program in orange. And you can see how in every area from physical health, emotional health, energy, and pain, all those symptoms vastly improved after making those lifestyle adjustments. So a few take-home messages. One is that lifestyle factors such as what we talked about today, nutrition, exercise, sleep, stress resilience, can really have a profound effect on optimizing lymphedema management. And we feel that of these, proper nutrition may have the greatest impact. But it doesn't have to be daunting. It can be done. And as Robert talked to you about already, is that even those small changes can really get you on the road to feeling better more often. So consider taking some kind of initial step now. Maybe that step is just researching the topic and see what is going to be best for you. We're going to give you some resources in the next slide to help you learn more. And then tell somebody about what you decide to do so they can help hold you accountable. And remember that taking that small step or a huge, bold change doesn't matter. Whatever is your preference, just make that effort.
Yep. Well, you just want to start somewhere. The first step's the most important step. So here are some resources. Of course, we have a program that we have put together, and it's a self-paced program that that you can sign up for at that website right there, tinyurl.com/ls-online, or if you Google lymphatic lifestyle solutions online, you should be able to find it. Cell care therapy, that's my clinic here in North Carolina. So there are some resources and things on my website. Leslyn has an excellent website as well with lots of good resources on, leslynkeith.com. Lymphedema Simplified is an organization that we definitely want to put in a little plug for. Leslyn is involved in that, and that's for those of you that have lymphedema along with the lymphedema. And there are really good resources there. We wanted to mention 3 Facebook groups that can be really good and useful. One is called Keto and Fasting for Lymphedema. There's one called Lymphy Strong Cafe, lymphedema food support group. So and they also have like a ketogenic approach, and then keto lifestyle for lymphedema. And then the last part there is a published paper that Leslyn and I published in the Lidsum Publishing, Optimizing Lymphedema Outcomes Through Lifestyle. Most of our presentation today has been based on that, what was in that article. So if you want to deep dive a little bit more into what we talked about today, that would be an excellent article to look up as well. And finally, if you want to contact us, feel free to do so. Here's our contact information. We have an email that goes to both of us, lymphlifestyle@gmail.com. Or if you want to contact either one of us individually, you have our email addresses right there. And I believe
Thank you, Robert. Thank you, Robert.
Yeah.
Thank you, Leslyn, for the presentation. We do want to get to some questions. I also want to mention that LymphaPress offers many opportunities to support the lymphedema and the lipedema communities. In fact, I'm going to put in chat right now our link tree. We host monthly lymphedema roundtables and lipedema roundtables. If you've never attended and you could use some encouragement, we would really love to have you show up there. We also do research roundtables the first Monday of every month, where great groundbreaking ideas are discussed, and then webinars just like this, where we're so glad that you attended. So there were some phrases that you used that really struck me. Permanent uncertainty. Talk about a stress inducer. I mean, the number one cause of fear is uncertainty. And this permanent uncertainty is something that requires support. It's not just about the physical. We could talk about your eating plan all day long, but the emotional support is so important. Did you want to speak to that at all before I go to questions?
This was an article that Robert had found, and they're talking about what are, in that group of participants, what was their greatest stressors. And I know we've all talked to someone with lymphedema who said that they are way more stressed about their lymphedema than they ever were about the original cancer. That this has had a much more, a greater impact on them. Robert?
Yeah, Absolutely. And that's, I think you make an excellent point there. And that's why these bubbles are so closely intertwined. You can't pull one out, because if you're dealing with all of this stress, then it's almost like you don't have enough brain space left, or bandwidth in your mind and emotions to even think about what you're eating. So
Yeah.
so you have to kind of, and yeah, support is key. We're a firm believer in that. So like these roundtable groups and things that you guys do are awesome. And yeah, there's a lot of
And
good
so many
resources.
patients have risen up as fierce advocates, and we need that. We need patients to be champions for themselves. And when they're ready to put their shield down and they're tired of fighting, we're all here to encourage them. We really appreciate people like you, Robert and Leslyn, who are working toward helping patients and clinicians. And so with that, I just want to get to a few questions. And
Can I say one other resource for stress?
Sure.
And Kathleen is here. She wrote this book, stress reduction for lymphedema. And so check that out. She gives some great ideas. It's almost like a workbook on things you can do. So check that out.
And by the way, required reading for those of us even who don't have lymphedema, because the tools that she includes can help you with everyday life, everyday stress. So thank you for mentioning that. That was on my to-do list. So you got that. So we do not offer medical advice in these webinars, but we will, in general terms, address some of your questions. Crystal Green says, I was obese, had bariatric surgery, lost and maintained 180 pounds over the last 5 years. First of all, kudos to you, Crystal Green. She says she's just now being diagnosed with lipedema and possibly lipedema in her abdomen. She had so you can say the word better than I can, Leslyn, panis
or paniculus. Yes,
ectomy in December, but has had swelling and edema the last few months, especially in the warm weather. Her question is, am I doomed to keep having fluid buildup even after the weight loss? She eats very clean, organic from her garden, and she works out 5 times a week.
Yeah. So, and I don't know what part of the country you're in, but there are some bariatric surgeons who are also well versed in carbohydrate restriction and ketogenic diets. And depending on, other comorbidities that might have developed secondary to your bariatric surgery, getting special guidance individualized to you might really help with that. Because what we're seeing is that something, I think, disrupted your abdominal and probably intestinal lymphatics with the surgery and with the paniculectomy, that it's just like this continuous fluid load that's happening there. And then the more it sits there, then you're getting fibrosis and other things happening there. So I would really want to have someone who can guide you specially on that. And what we're finding, and I don't know if this is your situation or not, but we're actually finding that carbohydrate restriction, yes, but maybe not high fat in that case, because we needed to not burden the intestinal lymphatics so much with a lot of fat. And so that's why I say it's really important that you get someone who is really versed in nutrition and can individualize this to your specific situation, because you have quite a burden on your lymphatics right now.
So well said. Did you want to add anything to that, Robert?
No, that's good.
So that's a really important distinction. And just the term, first of all, someone asks, is there a difference between the term ketogenic and keto, or is it just a shortened version of it? Okay.
Yeah.
So for people who have told their whole life that fat is bad, to hear a diet that is heavy in fat is scary.
Absolutely.
How do we surmount that mental block? And it's a very real thing.
Yes, Robert, I think you're the best person to speak to that.
Yeah, where do you begin with that? I know even for me, I'm my nature is to do a lot of research on things and question things. So I did dig into it, and I think one thing that gave me a lot of confidence was when I saw the credentials of so many that work in this field, and I had the opportunity to meet with Dr. Westman, who is at Duke Lifestyle Medicine, and of course the worry with fat would be that our arteries would clog up and then it would be bad for our heart. But when we really dig into the research behind that, it really wasn't, it was never really substantiated to begin with. There was more of a hypothesis or a theory that may be. And then when we look at the studies that where they came up with that conclusion, most of those were correlation studies. So if we look at that, then there's really a lot of room to question that idea that fat would be so bad for us. So one way to think of it is they drew conclusions from correlations, and the correlation would be that people that buy longer belts for their pants are more likely to have heart attacks. So therefore, we should not buy longer belts. That's facetious, but
Okay.
yeah.
Okay. Because
That's
I'm like,
also
let me go, let me go
no,
check my closet here.
yeah,
And now
no.
I see and get the tongue-in-cheek
Yeah.
point that you're making,
That's the tongue-in-cheek one. So that's a correlation, but it doesn't mean that it's a causation. So when we look at that, there's a lot of good books on that. There's one called Good Calories, Bad Calories. Dr. Westman, Eric Westman, has written a couple of books too, where he deep dives more into that also.
Okay.
So if you're worried about that, I would research some of those sources to get the other side of that argument.
And you're
in the
excellent.
meantime, you know, just have the fatty foods that you feel okay with. If you're okay with having eggs, if you're okay with having dark meat with poultry, so that's a little bit more fat than a chicken breast. You know, try to find the ones that you feel okay with while you're experimenting and expanding your diet.
And to clarify Valerie's earlier question, she wants you to know she does not have diabetes, but she's concerned about pushing into high bordering type 2 diabetes. How do you keep from falling into that with limited carbs, or should one do simple carbs? And again, we always recommend deal with your physician or a nutritionist in this case. But is there a broad brush answer we could provide?
Well, the broad brush answer is that the research is showing that, especially type 2 diabetes, that it's reversed by this way of eating. But Valerie, there's something individual going on with you because you've tried various things, but I think you need a healthcare provider that is well-versed in not just nutrition, but ketogenic nutrition to help guide you. Because for you, we need to make sure that we use these foods and not these foods. But really keeping your carbs below 20 grams per day is going to not send you towards diabetes, but something is going on with you that I think is very individual. And it could be with the amount of protein that you're eating, or not enough protein, not the right level of fat, but it needs to be individualized for you. So that is unfortunately going to be a bit of a challenge for you.
So Valerie, we want you to know we see you and we hear you and we definitely care. And obviously we can't give you any kind of specific guidance here, but we would like to connect you with any healthcare professionals that are in the Lympha Press network where you live. So I would recommend please reach out to us through our website and we can connect you with people that are really wonderful who can help your specific situation. We have a question from Rachel Cooper. Even if you're not overweight, is the ketogenic diet still helpful for lymphedema?
Yeah, and Robert, I don't know if you did this in your clinic, but I definitely had some patients that were willing to experiment it with in my clinic. That I had several that did not have a weight issue and said, well, what would this do for my lymphedema? And it, you know, anecdotally, case reports, it had a very, very favorable reduction on, you know, how fat collects in your limb that has lymphedema. Sometimes it's not just fluid anymore. You get a lot of fibrosis and fat tissue, even if you have no weight problem at all. It is in the limb that has lymphedema. There's fat there. And with this way of eating, we were able to get a volume reduction with those persons. So it's important to remember that a ketogenic diet is not a weight loss diet. It's a weight regulating diet. It helps you be at your weight that's good for you.
I'm glad you brought that question up, because maybe we didn't emphasize that enough in the presentation, because we do talk about obesity because it's so prevalent. But yeah, I've also had anecdotal or cases that did not need to lose weight, but saw improvement in their lymphedema. And also, if we look at those studies that Leslyn was talking about, that did not particularly pertain to lymphedema, but in actual formation. Of course, a lot of those were animal studies, but we got that one in Belgium that's coming out. The results are coming out where they're not necessarily looking at weight loss. There's plenty of studies to back up the weight loss argument, but these newer studies are showing that new lymph formation, like improvement of the lymphatic functioning by this way of eating. So that's really exciting, and that kind of opens it up for a much broader use, not just for weight loss.
How would you make a distinction between a Mediterranean diet and a ketogenic diet for those who are asking in our audience?
Yeah, Robert, would you like to take that?
I would say the main difference. I know and I probably don't know enough about the Mediterraneans to answer it really well, but I would think that the Mediterranean has more carbohydrates than what the ketogenic diet. Maybe the thing that they have in common is that they emphasize on real food, and that's good no matter what. Anybody that changes from processed food to real food has taken a step in the right direction, no matter what you call that diet.
Yeah.
Okay.
That's what I would say. But there's a lot less carbohydrates in the ketogenic diet.
Yeah. There was a wonderful study that came out of Poland, I think just last year, and they were looking at women with lymphedema, and they used a low carb diet, Mediterranean style, and a ketogenic diet. And what was the impact it had on their lymphedema symptoms? Both groups improved. Both groups did great. It's just that the keto group did even better. So it shows that even a little bit of carbohydrate reduction, even if it's not all the way down to ketogenic levels, is going to help. You're going to see decreased pain. You're going to see decreased volume. You're going to see decreased swelling. If it's too challenging to go all the way to really reducing to 20 grams of carbs per day, then don't do that. Go low carb and do Mediterranean. It still has a wonderful impact.
Okay. So not to beat this into the ground, but when your doctor says your cholesterol is really high and you need to add a lot of fiber, and all the things on the fiber list are carb dense.
No, actually, the high fiber vegetables are low carb. It's because most of the plant has that fiber that's not digestible by humans. And so that goes straight through you. So the leafy greens, the broccolis, the cauliflowers, the celeries, all that kind of stuff is very low carb because it's high fiber.
So it's because I'm gravitating toward rice.
Now that is high starch. The rice is going to be any grain.
True confessions. All right. Well, this webinar is not about me, so we'll just carry right on. And I also want to say too, this whole sleep thing, which is so frustrating for people that have trouble sleeping.
Yes.
But I'm encouraged to know that there are actually sleep studies now that you can do in the comfort of your home.
Yes.
Like old school, you had to go away and get hooked up to a bunch of stuff. So if that is open to our audience and patients who may be concerned about sleep, sleep studies can be done at home.
Yes. And you can order your own sleep study without your physician doing it. You can order it. You're going to have to pay for it yourself. And I did it for $250 just to get one done. And then I can can that results to my doctor and say, here, now should we look into this further? You know, maybe you have to take that step, because if you don't sleep when you go into the sleep lab, you're not going to get any information. So sometimes starting with a home study, maybe you need to have more backup to actually do something about it, but start there and to find out more about what's going on with you.
Okay, so we've already gone over an hour. I want to give each of you an opportunity, but it's good stuff. This is a great this is practical rubber meets the road conversation that can be so helpful and improve quality of life for people. So final words, Robert, what would you like to leave our audience with?
Oh, yeah, I guess I just want to repeat that it's always possible to improve some. And I like to, we tend to be really, really hard on ourselves. I find that with the clients that I work with, that a lot of times I have to point out to them how well they have actually done. If they set a goal to not eat any ice cream for 7 days, and they eat ice cream once, they come and tell me about that one time and they're all down about it. And I say, look, you went from 7 to 1. So celebrate that, and always look at better than. Are you doing better than you were doing before? So compare to what you were doing. And if you made some little improvement, celebrate that and keep moving, because guilt and shame does not motivate us very good. So keep it up.
Agreed. Excellent point. And by the way, a few more notes. Kathleen Lisson wanted to mention keto foods are actually healthy foods. Leslyn has that delicious looking slide of all the keto foods, and it's true. It was real food, not packaged food.
Right.
And before we go to you for final words, Leslyn, Rachel Cooper wants to know, is it best to exercise with or without garments?
So by far, usually it is going to be better to exercise with garments on. And I'll have to tell you, I have a slight bias because I've been working a lot with Kelly Bell. And when we look at central lymphatic dysfunction, then compression garments can actually be counterproductive. But I would say by far, the usual lymphedema picture, exercising with garments on is going to be so much better. If you're able to come to the NLN conference coming up in October, we're going to be talking a lot about central lymphatic dysfunction. If you seem to have issues with exercise and swell, even though you're wearing garments, come to watch that. It's also going to be available virtually. So check out the information we'll be giving on central lymphatic dysfunction, which Lymphpress had a fabulous webinar earlier with Megan Asher from UPenn talking about central lymphatic dysfunction. This exercise and compression can be an issue for that individual patient.
And that webinar and all of our webinars live on our website or the YouTube channel for Lymphpress. Lots of your questions can be answered, and it's just a valuable resource. Okay, we're going to squeeze one more question in. We've talked about real food, but are keto protein powders okay sometimes? Val Grace Brooks wants to know.
So protein powders, unfortunately, can be very constipating. So for someone who has hypoproteinemia, you have low protein in your blood, and we need to do something to get more protein in there. That can be valuable, but I would not want to do it long term. You just think about, we're trying to encourage you to eat real foods, and we just don't find ground up protein in nature. So it might be a short-term strategy to help with some condition you have, but try not to look at a long-term of relying on those. Robert, do you have anything to add to that?
Yeah, I agree. And it's one of those where sometimes you have to look at better than, like you said, it's a strategy. It's better than a can of Coke or that evening bowl of ice cream. So if you're traveling and you're in a situation where you just need something, and you could even add a little, what I've done sometimes is I'll do a protein shake and add some heavy cream so that it's a little more filling, and it adds a little fat to it, and it will last me longer, but not something we want to live off of.
That actually sounds really yummy. All right. Final words, Leslyn.
My final words are that those little steps matter, and think about those non-scale victories. We focus way too much on the scale. Think about our Robert and I are saying is feel better more often. So what are the ways that you feel better? How is your pain levels? What's your hair quality, your nail, your skin quality? What's your energy level? How do your clothes fit? Those types of things. Stop looking at the scale.
I love too when you said change our definition of exercise. If it is
Yes,
walking to
yeah.
the mailbox,
Yes,
then that's a win. That's a
yes,
victory. If it's
yes.
challenging and you do it, we applaud you. Small steps, do something, do
Yeah.
something.
Mhm.
I also loved your point about being stress resilient, but I think my favorite point of all was upward spiral.
Yes.
So may all the tips and strategies and advice offered here in this webinar be a catalyst for an upward spiral for our patients that we are honored and privileged to treat. And with that, I want to thank all of you for tuning in to this educational webinar. Again, visit us on lymphapress.com. We offer so much great content, and every month we're doing new stuff. Join us and be encouraged by our respective communities. So with that, thank you, Robert. Thank you, Leslyn. Thank you, everybody, and have a great
My
evening.
pleasure.
Thanks. Bye-bye.
Bye.
Thank you. Bye-bye.